We're leaning into medical cliches this episode. Is it really true that men don't go to the doctor until something falls off? And do women really jump to their own conclusions after a deep dive on Google University? We're going to take these questions to the professionals. Welcome to On Call Off Script, the Jackson Health System podcast. I'm your host, Ruelle Champion. It's the battle of the sexes. Who really takes better care of their health, men or women? Our guest today, Dr. Rodriguez, he's a Jackson Health urologist, and Dr. Munagala from Miami Transplant Institute. She works in transplant cardiology, and they're going to join us to talk about this topic. Now, I want to start with Dr. Rodriguez. We want to talk about the male perspective working in urology. I can imagine or assume most of your patients are men. What is that like?
Yeah, so I have actually a funny, interesting practice because even though I'm a urologist and, the majority of the population would think that as a urologist, I should be seeing mostly men.
Right.
I actually did a female urology fellowship.
Wow.
So I specialize both in men because I'm a urologist, I see a lot of men, but I also see a lot of women because I did 2 years of female urology fellowship for female pelvic medicine and reconstructive surgery.
Wow.
So in terms of the topic that we're talking about today, I see both ends. I see a lot of women. Today I saw half of my practice was just women, and then the other half I see a lot of men, and you see a striking differences between both men and women from a patient perspective in terms of how they seek medical care.
Well, before we start talking about seeking, what do women come to see you for when they're going to a urology appointment? What are they being treated for?
Right, so as a urologist I see a lot of, for example, a lot of recurrent urinary tract infections. Kidney stones are both prevalent in men and women. Blood in the urine can be very common in women and men both. I see a lot of women with pelvic organ prolapse. Urinary incontinence is a huge problem. Both either stress or urge incontinence. And so those are the most common type of urological problems that I see in women. There are other things that are common, for example, kidney cancer and things like that can happen in both genders. Recurrent urinary tract infections, low estrogen levels, pelvic organ prolapse, all those things.
And so now when we're seeing these female patients versus our male patients, even if the diagnosis is similar for both genders, what do you notice are the differences? Are the stereotypes true?
Yeah, the stereotypes are unfortunately quite true. So, I mean, when you look at women, I like to kind of make an analogy. Yeah. The women kind of comes to the urologist or comes to see me as soon as the smoke starts to go off, right? So the smoke detector detects the smoke, and the smoke detector kind of goes off, and that's when they start going to the doctor, right? The man comes when the house is already burning down. That's really when the man shows up in my door.
Got it.
And it's interesting because there's obviously different anatomical, differences between both men and women.
Of course.
But just the way that they walk through my door is completely different.
The energy's different.
The energy is different. Well, the women usually call early. The women made the appointment. The women shows up early on time. The man, probably the women, his wife made the appointment for him. When he walks in there, he has this confused look. Why are you here? And half of the men tell me, well, I don't know. My wife told me to come.
Oh, my goodness.
And you get this confused look. Why are you here? And so it's interesting because, the best is when you see couples. And I see sometimes couples in the same room. The women comes to see me for their urinary incontinence or other issues. And then the man is brought by the wife who has maybe BPH or who may have noticed something is going on, is getting up too many times at night to urinate.
BPH.
Something is off. Benign prostatic hyperplasia. Sorry, I should say that.
Yeah.
And the man maybe is getting up 5-6 times at night to urinate, and she kind of brings him along because she's like, that's not normal. Yeah. You didn't used to get up that often, right?
Right.
And so the woman is sitting there and she's got all these questions prepared. She's ready to go. And the man is like, why am I here? Like this confused look completely, right?
Right.
And it's funny to see that interaction, especially when you have the couple in the room at the same time coming in for urological care.
That is funny. Dr. Munagala, that begs the question for you too. Working in transplant cardiology, things get pretty serious. So is it the same instance? Do women start at the beginning and do men wait till things get intense?
First of all, I just wanted to, I thought you would be one specialty where men would be flocking because erectile dysfunction is their top priority and urologist would be the person that they would come running to as that's their top priority.
That is interesting.
For women, urinary incontinence is something that's, publicly, that's something that's, social exposure-wise, there is stigma. And they would come early to seek help because of that. But I would think that's one specialty where men would come faster.
You bring up a true point, a very good point. But the thing is, we're really scratching the surface in terms of the men that we're treating with erectile dysfunction. So the men that comes in with erectile dysfunction, most of the time already are coming in quite late. Many times that men try to tough it out, try to think, okay, let me try to buy pills on the gas station to see if that pill will help me. Do all kinds of crazy things that men do to try to get back to erectile function before seeking actual medical attention. And so the men that do come, many times are coming in already late in their disease stage. And I wish more men would come. Sometimes the women, believe it or not, bring me their partners. And they tell me something is not right. Something is different. Something has changed. And it's sort of that, because we deal with a lot of these intimate problems, men don't kind of want to accept that they're having trouble with erectile function or these sort of very intimate issues. And it takes them a while. It takes them some time to sort of understand, okay, well, maybe this is beyond my control. Right. Maybe I cannot wait this one out. I cannot tough this one out. I have to maybe seek medical attention.
Right. And so then when we're talking about heart care, that's not really something you can tough out and wait on. So what are your thoughts?
I was going to say that. So there is nothing to tough out the heart disease as well.
No.
So, but interestingly, it's a little bit different in at least cardiac arena.
Yeah.
Women have heart disease in equal proportion to men, but they don't seek cardiac care as much as men.
Really?
Part of the thing is the symptoms are very typical of in men, the heart attack symptoms. They experience chest pain, they experience shortness of breath, really feel like there is elephant in their chest. So they come and seek attention either because of their own symptomatology or because their women in their life will make them seek care right away. But whereas women, as number one, as caregivers, and also because of the way they experience symptoms differently, they're not as obvious symptoms in heart disease as they are in probably some of the other specialties. So they tend to get care at a later time.
Interesting. But talk to me about those symptoms. What's the difference?
So they experience a lot of what we call atypical symptoms. They can experience nausea, vomiting, fatigue, weakness, very non-specific symptoms, because of which the cardiac care is delayed in women. And the other thing is, especially if you're a younger woman, you go to ER with palpitations or shortness of breath, you're labeled with anxiety before you look into heart disease problems.
Right.
So they are underdiagnosed, and most of the time care is delayed. And people sometimes have to go through multiple times to the ER before they get appropriately diagnosed with some of the heart problems.
Interesting. So how do you interfere with that process? How do we get in as early as we can to help these women? Because I think at the same time too, when we're talking about nausea and vomiting, sometimes that's just another day in the life of a woman, right?
Yes.
So how do we get down to it?
So part of the thing is there is education. And AHA, American Heart Association, has significant campaign, Women in Heart Disease. There is, in February, there is like a significant campaign that goes on, improving the awareness and basically making people understand these are atypical symptoms in women. That has definitely got it a little bit moving forward, but still we are not quite there where we should be. More education is what is required. Hopefully more people that are listening to podcast can understand that women can have different symptoms, including women who are listening to this. So pay attention to your bodies, pay attention to your symptoms, and go get checked out.
Well, that leads me to you, Dr. Rodriguez. How do you feel like education has made a difference in making those men a little bit more comfortable? Let's say we're setting up a scenario where a man comes in on his own. Maybe his wife did make that appointment. He's looking around all confused. How do we make him feel a little bit more comfortable?
Yeah, I think there's light at the end of the tunnel after all this. Even though I said that, it's very difficult for men to really come to the physician. And I think we're beginning to see the change and what has changed, what we're doing today.
Yeah.
Right. Podcasting or social media or being, having information readily available to men. And now there are a lot of influencers that these men watch, on YouTube or TikTok or all these like different social media platforms that talk about men's health and that raise awareness about all these issues, right? And many of them try to approach it in a way that makes men feel, okay, this is normal. Like, I don't have to be ashamed of this. This is going to happen to all of us. We're all in the same boat, right? Yeah. And if it's happening to this influencer or this influencer is talking about it, well, I'm no different, right? So then maybe I should get checked out because he's talking about it. I'm sort of feeling the same symptoms. I'm sort of, feeling I'm in the same situation. I should maybe go to the doctor. So I think the more we get the word out there like we're doing today, the more people are consuming this information in social media and the internet, the more they become more educated. And the more that they begin to sort of lose what was holding them back, and they begin to show up. And many times I've had many patients that say, I either saw your videos, I do, some social media, and because I love educating patients and putting that information out there for patients, or they tell me, I saw this influencer that talked about this issue, and I got scared because I was feeling the same symptoms, or I was, beginning to notice the same issues. That's why I came to see you. And so I think the more we do that, and I think as a society we're doing that already, and we're heading towards more information readily available on our phones everywhere. Right. I think we're going to be breaking that barrier a little bit easier.
Absolutely. Yeah. So overall, for both of you guys, whoever wants to answer first, when we get that patient in the door, no matter if it's a man or a woman, and you see that they're nervous and they don't know where to go, and they've come here and maybe they're at a very critical stage of their medical journey, how do we get them to woosah, calm down, and know that they're in a good place to get good care?
So I'm in cardiology. So critical situations are like day of life for us, especially I'm in transplant cardiology. So by the time people are seeing me, they have seen other cardiologists. So this is a little bit more advanced heart disease that we are seeing, I would be seeing. And we see variety of critical cardiac situations, from cardiogenic shock to like basically very decompensated heart failure type of a situation. So for all of those disease processes, supporting the patient and family through the journey is very, very important. Right. So what we do is educate them and support both patient and the caregivers. Because a lot of the time, the focus goes on acutely treating the patient, but it is also equally important to understand the caregiver burden and educate the caregivers. Because once the acute care is done, then family has to take care of these patients.
Of course.
So it's very important to understand what is that they're going to be assuming, the care that they're going to be assuming, and how to mitigate some of the circumstances that families may end up. We fortunately at Miami Transplant Institute have great social workers and great support team that we all work together as a team, and we deliver care at Jackson Health System as a team-based care. Right. Not one single person is like, you're going to be, I am the demigod, I'm going to care for this patient. We work as a team. Surgeons, cardiologists, social workers, nurses, our nurse practitioners, we all work together. And our goal is to provide the best care that we can to these patients and families. And that's what amazing. We do.
And I'm sure that makes a world of difference when we're talking about a man who's hesitant or a woman who never even saw the signs.
One of the things that I thought about this, because as I was coming in here, is like kind of thinking about what are the barriers, right, to men. And we sort of touched on some of them, fear of a diagnosis, the stigma, that I'll tough it out mentality, that can sometimes get in the way. But one of the things that I was thinking that happens differently in men and women is that women very early on have gynecological care. Because of pregnancy, right? Or other issues that may have come up early in development, whereas men don't typically have that. And as I was thinking, that most of the time that gynecological care sort of preps the women to kind of seek more care, be more involved in her health care, be more involved in thinking about her health, right? Whereas men sometimes don't really have a point of contact.
Beyond your primary care.
Right.
So.
And many don't have. I mean, there are significant statistics out there that show that, a good portion of men, it's staggering numbers, 30-40% sometimes of men don't have a PCP that they can easily say. They may mention that they had a PCP 4 or 5 years ago, but they don't currently have a PCP. And the statistics are very, very drastic in terms of men versus women in terms of PCP and access to care. But the women have always that gynecologist. And that gynecologist sort of like, it's a touch point, where you can kind of touch base and say, is this okay? Do you think I should see somebody? And that instills in them that ability to continue to seek care and that it's okay to seek care, whereas men are sometimes lost. And in fact, we see this, and I see this also in my practice. Young men are the ones that we really need to target if we're really trying to break this barrier. Because those are the men that if you educate them young enough and you instill in them that it's okay to come and seek care whenever you're noticing something abnormal with your health, that's when you're going to see the biggest impact in terms of showing up to primary care doctors, looking for that referral, looking for that specialist.
Right. And I think as people are young, you have a sense of invincibility, right? Yeah. You feel your symptoms and you're just like, oh, it'll go away. I don't need to see a specialist. Maybe I'll do telehealth with my primary or CVS Minute Clinic and call it a day. But it sounds like both of you guys are saying making that extra effort, regardless if you're a man or a woman, makes the world of difference, especially having that support system with you. I mean, have you noticed that, Dr. Munagala? Like couples coming in, families coming in all together?
So yes, that's what I was going to say. So young men, probably less likely. As they get older, they have their significant others pushing them to take care of themselves. So, but I think young men may neglect their care a little bit more than young women because they do seek gynecological care. But I would say like a certain age, where caregiving age, like a mother, kind of like high school age children, women tend to neglect their health at that point of time because they are taking care of somebody.
Family comes first sometimes.
Yes, that's how women function, and that nesting mentality takes care of others before they take care of themselves. I do agree that the dialogue and conversation and constant education outreach into communities is very important for all of both men and women to take care of themselves. If you are not healthy, you're not going to be able to take care of someone else to begin with.
Very, very true.
So, and especially a mom or any woman who is matriarchal figure of the family,
right, head of the household,
needs to, like, they set the direction for the rest of the people. So if you see your mother taking care of themselves, if you see your wife taking care of themselves, or your sister taking care of themselves, then it gives good direction to everyone else in the family. You're
setting the pace and setting the example.
Exactly.
Awesome. So guys, I have a final question for both of you, for men and women. What is one final message we want to share about taking care of your health and making sure to prioritize those things that may be a little bit intimate or maybe a little bit critical? What do we want to say?
Yeah, I mean, one of the things that I would say is the earlier you begin to identify symptoms, the better probably it will be in terms of your care. Many times I see men, even with erectile dysfunction. I saw one today that came in and his hemoglobin A1C is already elevated through the roof. He has very, very high triglyceride levels. And the first thing I did is, yes, we're going to focus on your erectile function, but you need to go and see an endocrinologist and you need to go and see a cardiologist immediately.
It's because when we say A1C, we're talking about high blood sugars.
The diabetes, exactly. The high blood sugars, diabetes. And his diabetes are uncontrolled. It's uncontrolled. His triglyceride levels are uncontrolled. His cholesterol is uncontrolled. And more than saving his erections today, I probably, if he follows up seeing the cardiologist and seeing the endocrinologist, I probably save his life.
Right.
Because the earlier you come in and the earlier you detect those symptoms and the earlier you act, the better you'll be. You don't want to wait until the house is really burning down to show up at the door and say, help me now.
Exactly. And for you, Dr. Munagala?
So I would say, for women, you take care of yourself as you take care of men in your life. And for men, take care of women in your life so that they can take care of you longer. So that's what I would suggest. And also, I'm one of the cardiologists that does pulmonary hypertension. So we do as much PDE5 inhibitors, as in Viagra, as much you do. So I thought this is a good combination of a cardiologist or urologist, because I do pulmonary hypertension as well.
Specialties that you would never think cross paths.
Intertwined.
Exactly.
But definitely, because of my practice in pulmonary hypertension, it does intertwine a little bit.
Absolutely.
And a lot of the reasons for erectile dysfunction, many men think, I tell them, they come in for erectile dysfunction, but I tell them the arteries that are bringing that blood supply to the penis are exactly the same size of the arteries that are bringing the blood supply to the heart.
Wow.
So if this is happening already to you with your erectile function, we got to look at your heart. Imagine what's happening in your heart.
Imagine what's going on with your heart.
So I think, you got to take care of your hearts so that we all can live longer, so that we can see urologists longer.
Exactly. Thank you for that. Dr. Munagala.
So, and especially with the growing jokes apart, on serious note, with growing diabetes, hypertension, and obesity in United States and in world, heart disease is going to actually grow more, and we would want to prevent the risk factors for heart disease as well as heart disease itself. I'm a transplant cardiologist. People have to, tend to see us at the late stages of disease process. There would be a day, I hope, there's going to be a day where people do not need transplants, do not need LVADs, but when they need them, we are here. But we do hope that they're going to be such good healthcare where they would not need any of this and they can live with their own hearts.
Absolutely.
But while that is a
ways away,
we are here to help you.
That's amazing to hear. So it sounds like the lesson that we're going to walk away here with is that with the help of our specialists, as long as you make your health a top priority, you're still a winner. And obviously on top of that too, making sure to get in on those regular checkups with the primary care doctor makes a world of difference. Thank you both for joining us here today, making sure to set the record straight for both men and women. Thank you for watching On Call Off Script. Make sure to stay tuned for our next episode and follow us on social media at Jackson Health.